Okay, we were talking in the first recording about what the crossover claim is for, and you will see again that definition on page 177. Crossover claims are claims processed by Medicare and then transferred to a secondary payer like Medicaid, or if the patient has purchased supplemental insurance benefits, then Medicare will pay it and then automatically send it to the secondary insurance plan. So that's what that box is for. So that takes care of the policies. If you look at policy 3, it's the same with even less in it. You might have some patients that have multiple policies so that most of their expenses may be covered between those 3 different insurance policies. If we follow along in the book, you go to 179, and they address the Medicaid and TRICARE tab. Very simply, the top part of it deals with Medicaid. Remember, Medicaid is a government insurance policy for those of low income. And TRICARE, Champus, is a government insurance plan for active service members, active duty service members that are in branches of the service. We're not going to really address anything in there for this book, though I do ask you in the worksheet, what does EPSD stand for, SDT stand for? You'll find that on page 179. I also ask you, what is a sponsor? You'll see the definition for that on 180. Okay, but there is a tab that will address some of those things that you might have to record whenever it comes to folks who are covered by those plans. Okay, and then the book jumps back to the diagnosis tab now. The diagnosis tab is the reason why the patient, not why the patient is here, but what the doctor has determined is wrong with the patient based on examining the patient and perhaps performing tests, that sort of thing. This is not something that we put in on our own. We wait for the physician to determine what the diagnosis is, and then we record it. If the patient says, I have a headache, we don't go look for that diagnosis. We wait for the physician to determine what's wrong with it and put it in. And you'll note we can put up to 12 different diagnoses in here. These are all ICD-10 diagnoses, so that you're familiar with the ICD-10 coding. Good news is that you won't be looking them up. They're already in the database. You can see them all here. Okay, now I've changed this around. I don't know what this patient had. I won't save it so that it'll go back to the original. This is Susan Arlen. Oh, she had bronchitis. Okay. The next place they lead us to is page 184 in the condition tab. The condition tab is an optional tab. You don't always have to fill it out, but it's always a good idea to fill it out as completely as possible if you have the information, because some insurance companies want to know every detail, and they will not pay the office until they have the details. So, for example, injury/illness/LMP. What was the date that this patient was injured, got sick, or had their last menstrual period? It depends on why you're seeing them. Those are the 3 common ones. What were their dates of similar symptoms? What is their illness or injury indicator? Were they sick? Was it a last menstrual period we're following, or is it an injury? What was the treatment date of that? Were these same or similar symptoms? Was this employment related? Is it an emergency? Was it an accident? Is it related to a car? Was it an accident, yes or no, or was it a car accident? If it was a car accident, they like you to capture what state it occurred in. How about the last x-ray? What was the nature of the injury? Was it at home, at school? So you can see all the different more detail-oriented stuff, and you don't have to type it all out. It's all there. Now, I will ask you as well on the worksheet and in the homework assignment, the Karnofsky Performance Status Scale. The definition for this is on page 185 in your book under Death/Status. There are, I want to say 11, and I can't recall if it's 11 or 13, different states that the patient can be in. Are they normal? Are they dead? Are they able to carry on? Are they disabled, severely disabled? So the doctor can rate that, and you can capture that in here. When were the times where they were on total disability or partial disability? Can they work? Were they hospitalized? When does the doctor say they can come back to work? What is their percentage of disability? So you see all these things that we can capture, as well as pregnancy and estimated date of birth, that sort of thing. The condition codes are usually for UB04. Again, those are for hospital billing, so we won't be using those at all. Okay, that takes care of the condition tab. We get to the miscellaneous tab. We're almost through the tabs here. And the miscellaneous tab deals with laboratory information. And you might have, your office might assign other information that you want to capture. Okay, so this kind of gives you some wiggle room to capture more information. How about the prescription date, if it's for hearing or glasses or something like that? Authorization numbers by insurance plans. The extra boxes are, again, different purposes that you might want to track. What about the primary care provider outside of the practice? So we won't be using this either, but again, just showing you some of the features that Medisoft can offer. Moving on to we did the Medicaid and TRICARE. Let's do the comment tab. Finally, we get to the location where we capture allergies. Usually whenever a patient has an allergy, I like to type it in all caps because it really will pop. And once we put something in this, it will pop up on our screen every single time we click on that patient to remind us, patient has an allergy to penicillin or peanuts or whatever it is. There are other boxes here. The EDI notes, the electronic data interchange information, is about do we need to capture more information, additional information, certification, diagnosis. Again, we're not using any of these, and then we could capture that in here. Is there special notes that we have to capture about that? The contract type code. Is this a capitated plan, diagnosis related group, a per diem? All of these things are ways that we can capture things, but we are not using any of these. Again, we're going to keep it fairly simple, and we'll still have you kind of working through, what am I doing? Okay, so that takes care of the comment. And finally, the last one, the EDI tab, is for when we send electronic claims to the insurance plan. We won't be using any of these at all, but in our cases we learn this, but maybe we have to track the hospice number, or if there was a mammography facility, what was their number? Was there a referral physician for the Medicaid access? So all these different things you'll see defined on page 191, and I'm not going to take a lot of time to define these because we're not going to be using them, but I want to show you at least all the things that can occur that you can capture. All right, and finally, let me slide this window over a little bit so you can see the buttons. When we look at cases, we have Save, Cancel, Help, View e-Statements, Eligibility, Face Sheet, and Set as Default. Let me cancel out of this a moment and get back to our main screen because I had messed up her diagnosis. Now let me open this up again, and remember, to any time we need to edit, we can just double click. So the Save, Cancel, and Help are self-explanatory. We have here, we can check the eligibility of the patient if we were actually connected to an insurance plan. Let me show you what it looks like when you click on this. It will come up, says, hey, you know what, this isn't available because you're not actually live with an insurance company. But if we had a patient who was covered by Blue Cross Blue Shield and we could check their eligibility, we can just click on that. It used to be years ago you had to pick up the telephone and wait 15-20 minutes while someone on the other end went through the files and found the patient. Don't have to do that anymore. View the e-statement, again, not something we can look at. The face sheet is a summary of the patient information. Watch when it comes up here. Here is my patient, Susan Arlen. Here is her demographic information, all here. Here's her employer. Here's the case that we're looking at right now, bronchitis. Here is her, who's the guarantor. Here's her referring physician. So it's a summary screen. Okay, kind of nice. And then finally, Set Default. Please don't click on this because this is how you change what appears and what doesn't appear. But I just want to show you all those particular buttons. Now, the last thing that I'm going to do is do a couple of these exercises in Chapter 5. So I'm going to go back to page Let me find exercise 5.1 on page 170. Entering data in the Personal tab. It says create a new case for Hiro Tanaka. Now, if you were with me in Chapter 4 or you're watching the recording, I created a chart for Hiro Tanaka. There she is. Notice, and I highlight her to get to her cases, but there are no new cases. So I have to make my case button active, slide down to the bottom, and click on New Case. And here they want us to put in the description. And steps 1 through 3 have you getting there. Step 4 has you search for her. Step 5 is what I just did, 5 and 6. And it says, enter Tanaka's reason for seeing the doctor. Now, if you look on her source document back on page 1, down near the bottom of the page under Other Information, the reason for the visit is low back pain. If you look in the book on page 171, it just says back pain. I don't care. Either one of those you can type in. As a reminder, we're not going to do global coverage. We're going to indicate she is the guarantor, because she is. Her marital status, she is single, and I'm finding this by looking at her source document, page 446. Her employment information is already filled in. Ta-da! 5.1 is done. Let's go to 5.2. 5.2 is filling out the account information. You'll note that Catherine Yan is her physician. That already filled in from when I created her chart. I'm going to look at her source document to see if she has a referring doctor, and she does. It's right above the words responsible party, and I'm going to go shopping for Dr. Bertram Brown. That one's done. Ta-da! 5.2 is done. Turning the page to 5.3, they want us to fill in the data for her policy. So I'm going to click on the policy tab. I'm going to skip the diagnosis tab because I don't know what the diagnosis is yet. I'm going to go to the insurance plan, and I can see it's Ohio Care HMO. Select it. She is, as relationship to, she is self because she is the policy holder. Her policy number is, and it's called Insured ID number. When you look at the patient information form on page 446, 812-736. And her group number is HJ31. And they do tell you in the instructions, if you follow along on page 176, put in her start date as January the 1st, 2016. 01/01/2016. Okay. And they do want you to click on Accept Assignments of Benefits, and this is a capitated plan. And if you look closely at her insurance policy, she has a $20 copay. She does not have an annual deductible, lucky duck that she is. And they do tell you to change all of the boxes in the bottom to 100. Okay, so that's done. That's exercise 5.3. Exercise 5.4, if you turn to page 183, has us put in a diagnosis for her. Now, we're going to get the diagnosis by looking at source document 3. On source document 3 is called an encounter form, and at the bottom of it you're going to see the diagnosis, and there are two of them. There is M54.5, and we'll put them in the order that they provide them to us. M54.5, and you will see that's low back pain. And the second diagnosis goes down in default diagnosis 2, and it is W11. And it explains the diagnosis. She's fall on and from a ladder, XXXD. Okay, notice that it populates automatically. Done. Exercise 5.4 is done. Seems really easy, doesn't it? Finally, we're going to put in some information in the Condition tab. And I'm going to kind of talk quickly because my timer is running out. I get 15 minutes tonight when I record this. So under Condition, this is optional information. We're going to put in, indicate that this is an injury. And we're going to put in the date, enter the date of the injury, and we're going to pull that from source document 4, because we get a note here. The patient is here on referral from Dr. Bertram Brown. She fell from a ladder on 9/25/2016. Illness indicator is an injury, Initial treatment date for our office didn't happen until October the 3rd, 2016. And I believe the only other thing we need to capture is that this was an accident. I did say yes. No, I don't want to have this. It was, yes, it is an accident, and the nature of it, she was injured at home, and that takes care of this.